us to the end, and I'm going to bring up our moderator, John O'Quick, former president and CEO of MSH, chair of the Global Health Council, has been deeply involved in these issues, and has a fantastic new book, which I had the chance to sit and do a book thing with him at the Harvard bookstore not that long ago, called End of Epidemics. So, John O, do you want to bring up your panel, and we'll get going? And thank you for leading us on in the next session.
Thank you. Come on up, folks, take your chairs off. Start from here. Okay, everybody's got their chairs. So thanks very much for the introduction, Ashish, and thank you for inviting me to be here. There's a, I don't know whether you know the Pogo cartoon, probably that's before a lot of your times, but there's a Pogo cartoon that says if you want to be a great leader, find a really big parade and march in front of it. And Shauna Janssen, I think, has put together the big parade here, so I have the pleasure of marching in front or walking beside. Let me first start by thanking the Harvard Law School's Petrie-Flom Center for Health, Law Policy, Biotechnology, and Bioethics for co-sponsoring this. I think it's a real indication of the sense of the importance of vaccines, and in this case, the whole issue of rumors and disinformation. And thanks, of course, to the Harvard Global Health Institute. And congratulations, for those of you who know the Harvard community, getting 10 institutions from across both sides of the river. And I think doing it very strategically. For those of you who haven't been involved in the week, it started just up the road at I think it's the Museum of Natural History. Then it went across on Tuesday to the Longwood Complex, the School of Public Health and Countway Medical Library, and then back over here. And for those who follow the epilogue, next Thursday will be at the Cabot Center at lunchtime when Laura Spinney will be here talking about her book, Pale Rider, which is an amazing, amazing and unique story of the 1918 flu. So congratulations on that. And finally to the audience for really being here and realizing the importance of vaccines. I'm going to just say a few words by way of framing and then get to the panel. First, I don't think we can ever say too often and remind ourselves too often of the power of vaccination. And many of us take it for granted. But if we look at the most devastating disease in human history, probably infectious disease, which was smallpox, which killed a third of the people it infected and blinded and scarred the survivors. Probably lost 500 million people in the last century alone. That was eliminated, eradicated with the first vaccine that was developed. And if you look, the return on investment is the cost of eradicating smallpox returns itself every 27 days. And so that's basically, in essence, if you look at the time, since it was eradicated in '66, that was a gazillion to one return. We won't get that again, but that was pretty impressive. If you look in the US before immunization, at sort of current levels, we were probably having 2 million cases a year among children of measles, pertussis, rubella, mumps. Now it's less than 50,000, and if we hadn't let pertussis get out of line, it would probably be a whole lot less than that. And WHO reminds us, and again, I think we should always be thankful for what's achieved. Since the year 2000 alone, we've saved 23 million lives of children around the world with immunization. So I think it's important to start with that. There are a lot of different barriers to access. We've talked about those. And financing is one. Countries coming to the end of Gavi. Vaccine production. We've been struggling for yellow fever because we're making it in the same old way, and we've had big outbreaks. Mass population displacement will disrupt vaccination, as in the diphtheria hit Rohingya refugee camps in January. Armed conflict. So those are other things that will get in the way of immunization. But what we want to focus on today is the impact of rumors and disinformation. And they're probably as old, the rumors, conspiracy theories, blame, are probably as old as epidemics themselves. If we look back to the Great Plague, the Black Death in the Middle Ages that wiped out, what is it, a third of the world of Europe's population, or half, it was huge. It was very common then to blame the Jewish population. And there are stories of entire communities, a few thousand Jewish people basically put in a stockade, in one case on an island in the middle of a river, and the whole thing burned. That was what the rumors caused. And we saw in Guinea, 8 journalists and health workers slaughtered and thrown in the cistern, the school cistern, because they came into town. The rumor was they were spreading Ebola, and so the rumors are indeed deadly. The anti-vax movement is probably as old as the first vaccine. When Edward Jenner developed smallpox vaccine based on the cowpox and observing that the milkmaids didn't get chickenpox in 1795, the cartoons and the press was scathing. And you see cartoons of people who had grown hooves or udders and the whole cowpox thing. So it's an old movement. Unfortunately, we've got to recognize that the vaccine hesitance is not without merit. Going back to the early years of polio development in the 50s, there were some real misadventures there. 1975 with the swine flu. I spent that summer in Ted Kennedy's office and the Senate Health Committee, and I remember all of the turmoil around that. And in the end, in fact, we moved quickly, and that was, we learned later, caused Guillain-Barré and created some backlash on the recent cases of tainted vaccines in China. So other examples, we need to clean up and own up. So rumor and blame are deadly, but so is disinformation. And I think it's worth taking a minute to really understand the power, the lasting power of that. The last February was the 20th anniversary of what might be called one of the deadliest journalist articles. It was in 1998, February 1998, a guy named Andrew Wakefield published an article in The Lancet, which made a connection between autism and the measles vaccine. Even right when it was published, it was shaky. But what happened with that was that it got some hold. The tabloid press and then the mainstream press got on board, and they drove. At the time that came out in '98, UK had spent about a decade from the introduction of measles vaccines getting the immunization rate up by '98 to around 92%, close to where you needed. After the article and with the acceleration of the media, in the next 6 years, it dropped down to the 80s. It took an investigative journalist to turn that around, and it took 15 years to get back to where they started. So we went through a steady phase of coverage, and then it plummeted. Andrew Wakefield is still active today, and living in the U.S., he was debarred and everything else. But we got, just as an example of the impact of this myth, the vaccine autism myth, which is what was launched then. 20% of millennials in the US believe that vaccine causes autism. And a lot of, who was it that was starting out with that? Oh, with the dog, yeah. If you weren't here at the first part, we started with the example of dog vaccination and parent dog owners asking about autism. We almost eliminated measles in the U.S. in 2000, as in Europe, and then we had outbreaks in Minnesota, and this year in Europe, 40,000 cases of measles. A good chunk of that is due to disruption in areas like the Ukraine, but a big part of that, and we can track it over time. Heidi Larson's group's been tracking this. So there is a real cost to disinformation. So with those few comments, I want to turn to the panel, and we've asked the panel to each address from their own perspective 3 questions: the nature of vaccine rumors and disinformation, the risks, what are some of the consequences, and to think a little bit and share experiences on what can be done to overcome rumors and disinformation. So I'm going to introduce the panel, and we're changing our blocking a little bit on the stage. So you are going to get the mic because I realize you don't see so well from the back. So I want everybody to have a good look. So Heidi, if I could get you to come up as the first speaker. Heidi's a professor. Heidi Larson, Dr. Heidi Larson, is professor of anthropology, risk management, and decision science at the London School of Hygiene and Tropical Medicine, director of the Vaccine Confidence Project, and is an anthropologist by training, was head of global immunization communication at UNICEF, has done work with Chatham House, Gavi, is really the lead thinker on vaccine hesitance, and established in 2015, introduced the Global Vaccine Index, and has been doing a report on that, likes to do research on things like public trust and influencing policy. So Heidi, over to you. And thanks for coming from continent to get here.
Thanks. Well, as Jono said, we started this afternoon session with Carmel's comment that vaccines are contentious, and I would say that those contentions are contagious. The emotional contagion around vaccine is increasingly striking, thanks in part to the new social media and internet environment, which has changed the game. We heard before the comment about Ebola was very different, or the world around Ebola and the dynamics and the urbanization had changed. In the case of vaccines, the world around vaccines has changed dramatically in terms of the management and mismanagement of information. And we don't like to talk about emotions, but boy, vaccines have touched just about every nerve, I think, that we have in this field, and have really been confronted with that now. Ashish reminded us that in Spain, the Spanish flu was because Spain was a neutral country in the war. Why should that matter to the information about science and vaccines? I think the point is that vaccines and vaccinations are political. They're hugely political. Everything about them is political. We heard about the problem with the business model. Well, we've got problems with the political model. I think in the research we've been doing, and my group has been working on this for 10 years, I left UNICEF because I saw what was a growing, between 2000 and 2005, an absolutely growing frequency of local, subnational, and individual, but leader refusers of vaccines that I started at UNICEF I was recruited to be leading on the strategy and policy around the introduction of new vaccines, and acquired the nickname of being UNICEF's director of the fire department. And I left actually because I ended up spending most of that time doing crisis management, and again and again and again saw that a lot of these crises, confidence crises that had public health implications, could have actually, in most cases, been mitigated, if not totally prevented, if their early signals had been detected, characterized, and contained. Not much different than models of the viral spread of disease and looking for those early triggers, the amplifiers, and mitigating the impacts. So that was the model that I went off to set up this research group and to better understand the evidence behind what was driving these different things. So emotions, politics, and uncertainty in the context of what we're here today for, and in this really fantastic series of events over the past week, are absolutely fertile ground for rumors. So in our rumor characterization in the Vaccine Confidence Project, we talk about triggers, we talk about amplifiers, and we talk about impacts. And from that framing, we've developed a diagnostic tool where we try to go, when we get calls from countries, when we get calls from different places, what they want to know is how I've got 100 different pieces of misinformation and rumors and issues. Help us triage which ones we need to pay attention to. And one of the big things we see, I mean, there's histories of issues, there's a number of different things, but the political context is really important. Look at what's happened in West Africa. Look at what's happening now in Beni, in DR Congo. I mean, we've got a group and others too, tracking some of the what's up, some of the sentiments that are going around. And what we hear is, this is the same place of insecurity, kidnapping, and killing, so now Ebola is their new weapon. Somebody's brought it up from the equatorial area. It doesn't belong here. Somebody's brought it here. And so it's an environment of fear, of anxiety in general already without the virus, and that's added another layer. Children are fleeing from schools where they think there's going to be a vaccine coming because that's a new weapon. These are contextual issues that, aside from all the other challenges that we've been talking about and hearing about, are these other issues that we just haven't spent enough time anticipating, understanding, and coming to terms with over the years. As Mike Ryan said, despite all the absolutely incredible successes of vaccines, all is not well. I'm an absolute fan of vaccines. I'm a huge advocate, but I often, I think, have the perception of being the doomsday scenario, but I think we've got to come to terms somehow with this. And I know we've got a short time here, but just one of the things we are doing as an example of things we can do in this area, I'm leading a pretty big EU initiative in West Africa. It's a public partner funded. The EU puts in the money to the public part, which is the London School of Hygiene and Tropical Medicine, and there's a private sector part. In this case, it's Janssen and the Prime Boost Ebola vaccine candidate, and they have dedicated funding, and this is extremely rare and extremely needed in the area of work we're talking about today. Dedicated funding for a 5, now extended to 6-year effort called EBODAC, Ebola Vaccine Deployment, Acceptance, and Compliance. So we talked about CEPI at one end, and then we have to fill in the gaps between that. But this area of building the ground for community and public and political confidence, acceptance, and engagement. And then for something like a prime boost vaccine, the compliance to get the second after you get the first trial candidate and you want them to come back and make sure it's the same person, which sometimes they send a family member, which is not always useful in the spirit of sharing. But we've developed a rapid feedback system. I'm, as you heard, trained as an anthropologist, and typically anthropologists, you send them out there for 3 years, and by the time they're back, the outbreak's already killed half the village, so that doesn't work. We've come up with a model that is a rapid feedback system where we use the principles of anthropology, participant observation, local listening, and a team of community listeners. Once a week, rapid feedback with the clinical team, emerging issues, emerging questions, things that might have implications for how the participants are being recruited and in the process. One of which, for example, was anxiety about when they were recruited and in the initiation part of starting their participation in the trial were told and assured that there was insurance if anything would happen. Well, that started rumors in the village that if there's insurance, there must be something wrong. So what we did was get that message back to the clinical team, who changed the narrative of how they were introducing the insurance forms when they signed on, saying, this is not, to add a sentence that said, although, we are confident about the safety of this vaccine, but just as a gesture, and they've changed the language around it, and the rumors quelled. Now, it may not be always that straightforward, but it's just an example of how you can take an early signal and try to mitigate it with the right bit. I'm going to just sum up. We've written up a lot of this. We're continuing to do this and we've developing a lot of materials and guidance that is now being used in some parts in DRC, and trying to build on these because we're building a body of work around this to hopefully have better engagement and longer-term support for future outbreaks. One of the key papers we wrote about this is called Power, Fairness, and Trust, because these were recurrent themes in a lot of our discussions and rumors. And one of the other things, it was a phase 1 trial. We've done a long-term analysis from the beginning to the end of the Ghana, the suspension of 2 vaccine trials because of rumors. We've done an analysis of all the players, when it started, how it spread, and doing a series of case studies so people, before they go into these situations, can see how they can unfold, what are the things that make them amplify, and how you can mitigate negative impacts and ensure a successful trial. Thank you.